Hi, I'm Dr. Tanya. I'm a naturopathic physician and I work at Busy Light Clinic. I would like to take some time to explain how and why we prepare people for the complete Zerona package, and also explain some key concepts in fat and weight loss. My job here is to ensure that people are ready to get the best possible results and ready to get the laser treatments. You've probably seen the videos and know how the laser works to liquefy fat. That is what the laser does. What doesn't always happen is the proper processing and removal of the fat that comes out of the cells. So that's why we take a little time to assess and make corrections to people. Now, what the laser is doing, it's energizing the fat cells, increasing their metabolism, and after about 8 to 12 minutes, we get fat liquefaction. And this happens to 100% of the people that get lasered. After 8-12 minutes, there's a little hole formed, liquid fat and water come out, the fat cell collapses, and essentially it will shrink. Now, liquid fat, however, is still in the space between the cells, and that needs to be moved out. So that brings us to the next step, which is the lymphatic system, which is shown here in yellow. It's the lymphatic system's job to remove liquid waste and fat. And it does that and filters it and starts breaking it down and returns it to the general circulation. This is a very slow process. The liver then has to be able to metabolize those fats. Some of it will get turned into energy. The rest will actually get excreted as bile into the digestive tract, into the small intestine, and the fat ends up leaving through the bowels. So there's a few key organs and glands that I'm going to discuss and tell you how I assess them and how we work with that. The lymphatic system doesn't have a muscular pump. It relies on other things working properly. So we don't treat the lymphatic system directly, we treat other organs. One really key organ, as we mentioned, is the liver. The liver has to be working really well, it has to be vital, it has to be energetic. I assess this using my hands. Using my expertise in organ assessment and correction, I can tell how the liver is working. This is a far better assessment than any blood test that you're going to get. The hands are very detailed. They have a lot of information they can pick up. So while you might miss something visually, your hands often can pick it up. My hands can anyways. And so I'll see how the liver is working and in relation to other organs. Sometimes we correct it, often we correct it manually. Sometimes the liver needs a little bit more help or a little bit more information, and we'll give it that help to get it working properly, or optimally actually. The gallbladder and the ducts that come out of the liver, the bile ducts, also have to be working properly and clear. This is so that the bile can get out of the liver, the fat can get away, and it can enter the small intestine. The small intestine is another big area. It has a lot of lymphatics associated with it, and so if it's too tight, or if it's not moving properly, or if there's kind of chronic inflammation going on, it tends to backlog the entire lymphatic system and things don't move properly. Sometimes this shows up as cellulite, which is actually an issue of lymphatic movement. So we like to make sure that the bowels are moving regularly. That's very, very key. But also that the movement, the inherent motility of the small intestine is good, it's free, and it's harmonious. Now, those are the key organs. Sometimes we don't treat the organs directly. Sometimes we treat the restriction that's affecting the organ. But really, I rely on the person's body to tell me where those key restrictions are. Now, the key glands, well, they're all key because the endocrine system is one system divided up into different units, and they're all talking to each other. So we have the pineal gland, pituitary, thyroid, adrenals, and ovaries, or testes if you're a man, and the fat also has endocrine function. Now, the thyroid, as you may know, controls metabolism. If it's too slow, none of this happens fast enough to be appreciable in 2 weeks. So we have to make sure that the thyroid's functioning optimally. Now, sometimes it's not the thyroid, but the adrenals or the ovaries that are affecting the thyroid. So again, using my hands, I assess how does the thyroid feel, how is it moving, how is the pituitary moving, and based on how those glands are moving, I can also assess what can I give that, or what can I release in order to get those glands functioning properly? So really, when it comes to the endocrine system, we're looking at smooth functioning and harmony. The result is that the metabolism will be improved, and also the energy will be improved. So there's 4 main reasons that we do these corrections, that we take the time to make people a little bit healthier before we put them under the laser. The first is that clinical trials show up to 30% of people who get a laser program, laser treatment package like the Zerona, won't get results. By making corrections and making sure that the organs are working properly, and we've been doing this for about 2 years and we have it down pretty good, we can essentially eliminate all poor results. So I know that if people don't get good results, I know there's something wrong. It means there's something needs to be fixed. And once we retreat people, if they did not get good results, they will get good results. So this is why we can offer a guarantee on our services with the complete package. The other reason that we do the corrections is that so people will get better results. So when things are working better, the results are more complete. So people actually lose more and from more areas. The third reason that we go through all this trouble is that people feel better. So that gives me a lot of satisfaction as a physician, and that I see as being my role. And the other reason, the fourth and final reason, is that people continue to lose weight after they're finished with the laser program. It is not as arduous or strenuous to keep losing, and people have reported that they lose just by having a healthy diet and healthy lifestyle for the next 1 to 2 months, if that's appropriate. So I hope this explained how we do things, why we do things, and maybe it gives you a better idea of what package would be right for you. And so I look forward to seeing you in my office.